You always want to use the 6 rights of medication administration. So you want to have the right patient, the right medication, the right dose, the right route, at the right time, and the right documentation. So I'm going to knock on my patient's door. I'm going to introduce myself. Hi, I'm Abby. I'm going to be your student nurse today. I'm going to wash my hands. I'm going to look for the patient's safety, so make sure they have their call light, they're not falling off the bed or anything, there's nothing on the floor. I'm going to provide for privacy, so shut the door, or maybe if there's some family members, ask them if they could step outside for a few minutes. And always make sure you're using the proper body mechanics. So at this point, I'm going to check the medication administration record. So it looks like they're here admit for rehydration and antibiotic therapy. So the first order is to initiate an IV 0.9 NS 1000 milliliter to infuse over 6 hours. So I'm going to go and get my supplies. And this is 0.9 NS 1000 milliliters. I'm going to check and make sure that it doesn't have any discoloration, any leaks, expiration date. That's all good, and it's the right kind. I'm going to get my IV needle. I picked a 20 gauge. You want to pick your IV needle based on the volume that you're infusing, the amount of time that you're infusing over the age of the patient, that kind of thing. So I have my supplies in the room. I've already checked my order. I'm going to identify them by 2 patient identifiers. So, can I see your wristband? Can you tell me your last name and date of birth, please? And so then, patient IV needed. Checking my medication record, IV needed. I'm going to double check that I have the 0.9 NS 1000 milliliters for over 6 hours. So I got the right supplies. I'm going to ask them if they have any experience having an IV done before. If they have like an arm that they prefer. And I'm going to explain to them why they need to have it done. So I'm going to put an IV catheter into your arm. So you're going to have a kind of a continuous infusion of this. It's going to be to rehydrate you. Ask them if they have any questions about the procedure. And then I'm going to put them in a comfortable position. So I maybe ask them if they could kind of extend their arm like this. I'm going to crank the bed to a working height. And then getting ready to get started. Okay, so we are going to prepare the IV solution and the administration set. So I have this here. Gonna open that up. And I'm gonna make sure to label it. So I'm going to label it with the patient's name, the date that it is, and my initials. And I'm also going to label it with the prescribed rate, and that was that I determined earlier. So if you have 1,000 milliliters to infuse over 6 hours, and on the tubing, there's a drop factor of 10 drops per milliliter. So you're going to have 167 milliliters per hour and 28 drops per minute. So I'm going to write down the prescribed rate, the prescribed rate, the time it began, and the time of completion. And then I just double check that I have the right administration set. So the continue flow solution set. You're going to remove the tubing. And the first thing you want to do is close the clamp. So you just twist it all the way down to the other end, and then it's closed. You're going to label your tubing with the date and the time. That you opened it. They are good for 24 hours and they need to be changed. So by doing this, you need to maintain sterility. So you're going to pull off the blue part on the top, and then the cover of the spike. And you don't want to touch the spike, and you don't want to touch the top of this. And you're going to spike your bag. And then you can hang your bag on the IV pole. You're going to squeeze it to fill up your drip chamber. And you want to fill this up halfway. And then you're going to prime your tubing. So to prime your tubing, you're going to open that up again. You're going to open up your clamp, and you're going to watch as the solution goes all the way to the end, and then you're going to clamp it again. A little bit more. Okay. And then if you wanted to set your your drop factor now, you could, because you have this other clamp here. So if we're going to have 28 drops a minute, we can divide that by 4. And you're going to get about 7 drops for 15 seconds. So you're going to look here at your chamber, and then you're going to open your clamp a little bit, and you're going to count. So that's going a little fast. So you're looking at your watch. Okay. So when you have 15 drops per minute, it is going to come out this end a little bit. You can clamp it with this little blue clamp here, this first one there, and then your drop factor is already done. So the first thing you're going to want to do is place a linen saver pad under the patient's arm. Obviously, if this was a real patient, we would raise the bedside table up, or they could do it laying in bed. So we're going to have them put their arm in a dependent position. We're going to apply the tourniquet 4 to 6 inches above the selected site. So in applying a tourniquet, you're going to come around and make an X. You're going to pull this part tighter and loop the other side under, but not all the way. And then you are going to palpitate for a radial pulse. If you don't have one, then you did it too tight. You're going to have to loosen it and reapply it with less tension. You're going to locate a vein. You're going to look at the most distal vein and then work up. You want it to be straight and you don't want it over a joint. So you want to press it and see if it rebounds quickly. If it doesn't, you can have them open and close their fists, apply a moist heating pack, or you can get antiseptic wipe and go up and down. And then if they have too much hair, you can kind of trim it a little bit with scissors. And you're going to loosen your tourniquet. and grab more supplies.